I am Dr. K Sambasivaiah, working as the Chief and Senior Consultant of Medical Oncology, Hemato-Oncology and Bone Marrow Transplantation Services at Global Hospitals, Hyderabad. We deal with the chemotherapy services of several types required for several malignancies which are commonly known as cancers, both blood cancers and as well as other solid tumors from breast cancer onwards to lung cancer, gynecological cancer, gastrointestinal cancers. Our focus at Global Hospital and special interest areas include using of bone marrow transplantation and high-dose chemotherapy protocols for several of these cancer diseases, particularly blood-related cancers. The blood-related cancers, which are very difficult to handle, include the acute myeloid leukemia and acute lymphoblast leukemia. And the acute lymphoblast leukemia, which has got a good result outcomes, but those which fail have a very poor outcome. So the bone marrow transplantation offers a rare hope for these difficult clinical situations and for these very unfortunate patients having almost life-threatening diseases. So you require highly skilled, trained blood bank services and trained physicians. At Global Hospitals, we have a specialized bone marrow transplantation suites which have a sterile environment and laminar flow facilities. We have a dedicated nursing staff trained in bone marrow transplantation. The bone marrow transplantation is an important tool, as we just discussed, for treating and curing these hematological conditions. We also use this particular tool known as autologous stem cell transplant for multiple myeloma patients as well. We have a sophisticated and a modern equipment for stem cell apheresis in our blood bank. We use this particular equipment for phericing the stem cells from the patients or a donor. We have, in addition, an excellent facility for HLA typing for patients requiring allogenic bone marrow transplantation. We also have a facility for stem cell cultures and stem cell transdifferentiation and dedifferentiation facilities as well in our stem cell lab. Global Hospitals brings the cutting edge technologies, and in an endeavor to bring the cutting edge technologies to our patients, a bone marrow transplantation suite, and also along with it a trained and dedicated staff are available all around the year to service the needs of our patients. The Global Hospitals bone marrow transplant facility is one of its kind in South India, available for these patients. This particular therapeutic tool, bone marrow transplantation tool, is used as a curative treatment option for patients with malignant lymphomas. The malignant lymphomas are a diverse group of cancers known as non-Hodgkin's lymphomas and Hodgkin's lymphomas. Primarily, these lymphomas are treated by chemotherapy. Once the chemotherapy is completed, unfortunately, a small percentage of these patients will have a recurrence, a relapse of the disease. And for them, there is no other treatment to cure of that deadly diseases except bone marrow transplantation. Therefore, patients with lymphomas, relapsed lymphomas, can come to Global Hospital for this particular therapeutic tool known as bone marrow transplantation. We also use non-myeloablative transplantation to harvest the graft versus tumor effect for the benefit of these cancer diseases. The transplantation is used as an immunotherapeutic tool. We harvest the versus myeloma effect, a graft versus leukemia effect, graft versus lymphoma effect by performing a non-myeloablative transplantation in elderly patients as well, in whom the conventional myeloablative chemotherapy cannot be given because they cannot tolerate this particular high dose chemotherapy. We use a non-myeloablative conditioning regime and then do a mini transplant, which is known as a mini transplant in layman term. In technological terms, it is known as non-myeloablative transplant. This is also being done more frequently in our center for patients who are aged more than 60 years and above, in whom this allogenic bone marrow transplantation cannot be performed. The bone marrow transplantation has two types basically. One, the bone marrow collected from another normal individual and given to the person who has got the disease. It is called allogenic bone marrow transplantation. It is very complex. It requires a lot of facilities which Global has, and it carries a different post-transplant. Now, world over, these stem cells are now being collected from the peripheral blood, very rarely from the bone marrow. So therefore, the peripheral blood stem cell transplant is painless. It's like, the stem cell collection is like a routine blood donation. It just requires 2 to 3 hours lying down in a couch, and there is a stem cell apheresis machine which collects stem cells from the donor. It could be a normal one or the patient himself in autologous cases. So after that, it will be stored and retransfused. So it is not an operation. A peripheral stem cell transplant is not an operation, whereas a bone marrow stem cells, if need to be collected in select cases, it has to be done in a operation theater under general anesthesia, but it is not an operation. There will not be an incision. We'll use a needle to put into the pelvic bone and then aspirate the required amount of stem cells. Before we collect these stem cells, either peripheral blood or through the bone marrow, the patients will be given a growth factor known as filgrastim for 5 days to raise the stem cell numbers in the bone marrow or in the peripheral blood, so that we can get a good amount of stem cell harvest. All this is being done easily and more comfortably to the patient, and the cost also has come down of late, because the antibiotics, antifungals and antiviral drugs costs have come down, and the cost of both these peripheral stem cells and the bone marrow transplantation cost has come down dramatically in our country.